Hey, this is Dr. J. Davidson, and I want to give you a warning right now before you continue watching. There's going to be needles and some blood in this video. So if you are not a fan of that, do not continue to watch this short few-minute video of my PRP, Plasma Rich Platelet treatment. Or if you're not in an environment that would be friendly to watch this right now, just save it so you can watch it later. So let's continue, but that is my warning. So Dr. Tyna Moore is drawing my blood to get ready for the PRP treatment. So PRP is they draw your own blood out, and she's putting, I believe, a butterfly needle in my arm, and she's taken about 18 tubes for myself, taking the blood out. Now, I'll be the first to admit I am not a fan of blood and needles, but I was able to do this. What you're watching right now is actually my third treatment on my knee. Once she draws out all the blood, then what's going to happen is she's going to spin it down, extract the platelets, and concentrate the platelets for the treatment PRP. So it's my own platelets. She's got an ultrasound right now, and she's poking a needle in and trying to find where the gaps are. You can actually see where muscles were tore, where muscles were ripped up with the ultrasound. So she's using that ultrasound to guide the needle. This, again, is my third treatment. So she started working underneath my kneecap, which was very uncomfortable for me because dislocation of kneecap was my previous issue. But you can see she's basically injecting the PRP in. And she is, it got super hot in there. The heater kicked on. That's why she took her lab coat off, if you're wondering. But so she's injecting my kneecap. And you can see it from I actually didn't feel anything. She was explaining it all very well, but I'm like, Tina, I appreciate how well you're explaining it. I just don't really want to hear it. Just do what you got to do. Just get it over with, because I'm that guy. I see blood or needles, and I just want to faint. So now what you'll see now that she's working at was probably one of the most important areas that I believe, thinking back now on it, and it's been a couple months, or it's been about a month since we did this treatment, so I've had some time to heal up, and honestly, my knee is the best it's ever felt after doing this treatment. So you can see that big long scar. It was quite more pronounced the first treatment, and it's just continuing to go down because she keeps working at it. So what she's doing is she's breaking up the scar tissue. So I had a previous knee surgery. There's a ton of scar tissue that's in there, and that she felt like actually was inhibiting my muscle from firing because the scar was there. So she's working through the scar. You can see she's injecting the PRP in. It's looking all swollen, but essentially the PRP is causing inflammation so my body can heal itself. So the scar was a big thing. You can see that all poked. And now she's working with my VMO, my inner quad muscle. That was the muscle that basically disappeared from the scar, or from having the scar. And she's not actually doing PRP. She's taking the extra fluid that has growth factors, and she's injecting it to try to basically get some muscle growth there, actually stimulating muscle growth. I hope this video helped to explain my PRP treatment. Be blessed.